Well, welcome, Dr. Castele. Just like to ask a few questions, like what brought you to Medina and why did you bring your practice here?
Well, I went to Case Western Reserve University Medical School, and then we trained at Metro Health. It was Cuyahoga County Hospital back then, and then after that, I did a pulmonary and critical care training, fellowship at Metro. And at that point, you have to make a decision on where you're going to go out into private practice. And there was a cardiologist, Terry Tulisiak, who had come down to Medina, and I knew him very well. He was a year ahead of me. And he asked if I'd come down, and I grew up in the Cleveland area, so I wanted to stay in this general area. Most of my family's here, but I didn't want to be that close to them. So Medina was a good place. I always, liked the idea of practicing in a smaller town. And so Medina just worked out. It was a good place to be. It was close to where I grew up, but yet still had a small town flavor to it that I was interested in. And so we came down here in 1984.
What are some of your first memories of your practice here in Medina County? Did you cover the entire county or the city or just as needed?
We started a solo practice at the medical office building, which is next to the hospital. And I also did some consulting work at Wadsworth and also at Lodi, just because we were trying to build up a practice and get patients. And about half of what I did was inpatient care, and the other half were seeing patients in the office. So at Wadsworth and Lodi was mostly just doing inpatient care, and Medina was both inpatient and outpatient care. My first memories, I trained in a huge hospital system, and coming down here, it was not that. It was a small facility, and when you're in a specialty, you have other people working with you, but when you came down here, you were by yourself. So that was interesting for a while and challenging, but I think that was the first culture shock that I had to kind of get used to. So.
What changes at the county hospitals have made the biggest impression on you over your career?
The changes down here in Medina. Okay. Well, when you first came here, there weren't a lot of medical specialists. There were some of the surgical specialties. There weren't a lot of medical specialists, and I was the only pulmonary physician that was down here at the beginning. And as time went on, that just gradually changed. And you had more medical specialists here. You had more surgical specialists that came. The technology definitely increased over time. The technology advances were incredible, really, when you think about it, in the time that I was practicing. It still is today, but even back then, it was just huge. Things that we take for granted now was a lot of those things weren't available back then. So you had to use your other skills. But so those technological advancements were huge. Medical records advancements. Now you have electronic medical records. Back then, we just wrote everything down. I mean, it was a pen and a piece of paper, and you would write things down in your chart. And now that you have the technology such that you can share records, they're all electronic. People have access to their records. These are all things that I think have really changed in medicine and down here too in Medina. The acts of seeing patients, so hasn't changed. That somebody coming to you for help and you trying to help them. That part of medicine hasn't changed, and hopefully it won't. But in the future, so that's the basis, I think, of medicine. Most physicians, why they want to go into practice, to be honest with you.
What do you think is your most poignant memory of your practice, or persons or issues you've encountered?
Again, the most poignant were taking care of individual patients. I still remember after all these years, some specific patients and taking care of them and helping them with their medical problems were. I mean, that's clearly the most poignant.
What do you think about medicine today that might sadden you a little bit?
I think, you know, of course, you know, when you get older and you retire, you always remember the old days. So, you know, I'm not sure that it's that much different than it used to be, but I think we've depersonalized healthcare. As I just told you, the most poignant memories are taking care of individual patients and remembering them, and I think that physician-patient relationship is eroding, and from all aspects. Don't think the physicians are trained to necessarily see people as their responsibility, you know, now you're part of a big system, and you can have any of these 10 doctors can see you, and patients are, you know, they likewise don't have the personal contact with their physician. They don't have that strong relationship. So I think that's what I would say if you ask me what saddens me. That relationship that you have with people saddens me, and also a relationship with other healthcare providers. You know, in the back when I first started practice, you knew all the other doctors. You know, you knew their families. You would talk to them all the time about just what was going on in their lives, and you know, we used to go down and talk to the radiologists, and we would see them in their offices and then talk to them and show them X-rays, and now the radiologist reading images may be in another continent somewhere. So you don't have those relationships. So I think the lack of relationships or the loss of relationships would sadden me the most.
So, if you were to give advice to a someone studying to be a physician and coming to this type of locale or county, what advice would you give that person?
I think that my advice would be to always try and remember why it is that you decided you want to go to medical school and wanted to be a physician. I always thought that, you know, that you should be given your essay that you wrote when you had to write something to why you want to go to medical school and you're applying to medical school. You should always be given that every 5 years or so, and just be made to sit in some quiet, dark room and read it for 15 minutes and think about it. And so if you just remember what it is that you went into this for, would be my advice. You know, things are going to change and people are going to change. There's going to be problems, but people went into medicine for a reason, and that reason really shouldn't die. I mean, you should always think about that.
If you were to make a prediction for the future of medicine in our county, what might be thoughts that come to mind?
I think my prediction is that you know, now we have big hospital systems, mostly Cleveland, but some Akron, you know, that are taking over healthcare, and I think there's a sense that they want to centralize that care into the bigger cities, and so the regional care is not going to be as important, you know, as it used to be. So that's just something that I see happening in the future, and it isn't necessarily a bad thing. You know, that you have technology at the bigger institutions and more resources. All right, but you know, people have to travel, so that's the drawback. So we just have to come up with a balance there, so we don't lose the small town flavor that really I think was what patients want.
Very good. Well, what other thoughts might you have or want to share in our exhibit about thoughts about medicine in general, of looking at the past, what you've done through and gone through, and what you would like people to know most about medicine in Medina County?
Well, I think, showing how technology has changed over the years, I think would be very important. How healthcare is delivered would be very important. Um, Things like showing I don't know how easily you could do this, but showing how, medical records were kept back in the day and now how they are now and how that technology has changed would be important. Just if you don't mind, can I give you a short story? So I'm sure you'll hear the name Dr. Mansell, and he was still practicing, when I was starting, and for a number of years. And anyway, when he was retiring, he said, I have this patient. He comes up to me. I have this patient that I've been seeing for like 50 years, and he had some lung problems, and he wanted me to take over his care. And I said, sure. And he goes, well, I'm going to give you his medical records. Now, in like 5 visits, I would have, stacks of records already, so I'm thinking, 50 years, what? It's going to be like boxes and boxes of records, and so the patient comes in with his records, and he reaches into his pocket and pulls out like 5 index cards. That's it. And it had, 1948 appendicitis. That's all it had. There was nothing else. But it was basically just notes for him to know, and he knew everything about the patient, and he knew what care he gave and things like that. So it's different today, obviously. So people, I guess, should understand that, and the technology, how that's advanced over time, I think would be important for people to know. Um, I guess those would be the things that I would think you want to display. But also the people. I mean, most of the physicians, when I practiced here, lived in Medina. Their kids went to school in Medina, went to church in Medina, and I think they were part of the community. And I'm not so sure that is so much anymore. But I think the people of today should know what it was like back then, and so that's something you might want to think about, kind of emphasizing in your exhibit.
That hit the nail right on the head. Yeah, exactly right. Are there any final thoughts you'd like to share about your career and if it's possible to encourage people, as you've done, to get to know their doctor?
Yeah, I would say that people haven't changed over the years, and their problems really haven't changed over the years, and their health issues really haven't changed over the years. And patients need to, look to their doctors, and the doctors likewise have to look to their patients as, having strong relationships there, so that they can work together to take care of their health.
Very good. Very good. Excellent. I think that's good.
I believe, doctor, that you were the one that found the nodule on my lungs.
Yeah, I think I was.
19 years ago. And I will say that, number one, it's still there. Number two,
Okay.
it hasn't grown.
Oh,
So
good.
I guess I believe your advice is watch it. And if it doesn't do anything, don't worry about it.
I think I remember what your X-ray looked like. I do. So
He had a big badge showing right here when he was wearing his police uniform. Well, thank you very much, Doctor.
Yeah,
It was
appreciate
wonderful. All of your our interviews have been so informative.
okay.
And there are some common threads certainly among them. But
Sure.
I also think you've each kind of zeroed in on certain aspects, which is what we were really hoping for.
Okay.
A variety. Before you're right, the patient-doctor relationship is good and bad. It's still there, but not in the form that you knew it.
It's just different. So, and you know what? I don't think that it's ever going to go back. But I don't. It's not characteristic of this community. It's like it's nationwide. It's just the way that it is, and the way it goes. But I think what it's not just with healthcare. It's with it's with the schools, your bank, car mechanic. It's with everything. So, and that's too bad. So,
I think it's interesting when you put all these together. It's almost like this is a particular view, this is a particular view, this is. But centrally is that it's
Yeah.
a change from a personal relationship with the patient
Yeah.
and the doctors to now sort of technology takes over rather than the history and getting to really know the patient.
Yeah.
And been kind of a common theme throughout the whole series of interviews that we had.
Yeah.
And
I used to tell that, like, when I would be teach some residents or something or whatever, that with every patient, there's something in that patient that is in common with you. Is as different as it may seem that this person is, there's something in their life that's in common with you, and you need to try and find out what that is. And once you have that and you understand it, it'll be a strong bond. That'll be very, very important. But I don't know that people take the time or the effort to do that, to find that out. But
when I shared too, we used to have, the old charts that were on the room where you were going to go in and pick it up.
Yeah.
I'd lift everything up, and on the inside of the chart, I had written things about them. The thing about them, we had we motorhome together. We did this, or you had a dog named so and so, or you had this,
right.
And then you could pick that up, even if you couldn't really remember all the details. You'd written it down. You could go in and walk in and say, "Have you taken any motorhome trips lately?" and everything. And then the patient's eyes kind of lit up.
Oh yeah.
Because they said we've got something together, not just okay. You're a number. I'm going to write down.
Yeah, it humanizes.
Yeah, humanizes.
It really does. So, but
unfortunately, we've lost a lot of that.
Yeah.
Well, I think you're dead on. And what we hope for with this exhibit is that we can bring a little closer relationship to medicine as it was practiced for many, many years, and still the vital link is between you and your doctor more than anything.
Right.
So,
all right.
You're done for the day.
All right. Well, thanks. I hope that helps. Hear something, or if they had pneumonia, you would hear things. I mean, the physical exam was a lot more important back then, 100 years ago. But until you had x-rays that you could really see what was going on and start evaluating people, there was a limit to what you can do. And that was before therapies were available. So, I mean, it's obviously just a slow progression over time. But, technology advances on itself. So we can do more and more now. So
Pretty interesting.
Yeah, it is. So,
when we read old history volumes of ailments, and read the old ads in the newspapers 100 years ago, there was a cure-all about everything.
Yeah. Oh, yeah. Right.
So, mostly alcohol, probably.
Well, there still is.
Yeah.
The TV. If you watch the ads on TV,
it's it's just 20 minutes of medical commercials every single night. I said, come on, you could have had the weather forecast done 10 minutes ago, but you space it all out. But but that's how people are getting their information, right or wrong.
Yeah. Right.
I'm sure they come to physicians nowadays saying, "I saw this on TV."
Oh well, yeah.
Oh yeah.
And what are you going to do about it?
Yeah. Right. Well, the patients are much more educated. Obviously, they're very, very educated, and so they come with questions that you better be ready to answer, and that's not a bad thing. But it's when we train, you just basically told people what to do. They barely asked questions, and that was it. But now that you can't do that anymore, so you better know what's going on. So
the internet's a powerful tool, and even in the columns in the newspaper, because they can both have a medical. And actually, some of it looks pretty reasonable when people give their symptoms and the doctor tries to figure out is that right or wrong.
Well, and there's so much confusion. I mean, not trying to be political, but if you just look about what's on the news about vaccines or medications or whatever, I mean, it's so confusing, and the average person, it confuses them. You don't know what to do, who to believe, and then it's not a good thing sometimes.
Is that like whooping cough would have been up your alley in its day?
Probably not. I mean, that would be more like for pediatric patients, but whooping cough wouldn't have been a big thing. we had a lot of patients with tuberculosis. So, and you know, of course, when I was growing up, you know, everybody had infectious diseases, chickenpox, measles, mumps. You know, we all had them. So my granddaughter, she's 2, when she was about 9 months old, she had this rash, and you know, they're sending us pictures, you know, and FaceTiming, and I can look at this rash. They go, "What's this rash?" I'm looking at it. She had chickenpox, but they didn't know what you know, her parents, my son and his wife didn't know what it was. And I said, "Well, I think she's got chickenpox. You got to take her to the pediatrician, I guess." And the pediatricians never had seen a case of chickenpox, and you know, and wasn't really sure what to do, and she would have gotten the vaccine, but you know, she wasn't old enough to get the vaccine yet, so she ended up getting chickenpox before she could get the vaccine. And but so the healthcare providers had never seen it. It's like a rare case. Can you imagine that? So
You're right. My friend has a 5-month-old son, and I just talked to him yesterday while we were giving blood, and he said even though his wife's a nurse, they're totally confused in this whole vaccination thing. And now the kids in daycare 3 days a week bring something home every week that everybody gets, goes around the house, and you know they're confused. Even college-educated, bright people, one with a medical background, still don't know what to do. You're right. I think we've sowed this confusion to the point where people are just going to do nothing, which might be worse than anything else.
Tom Ebner was saying that Christy's daughter, general surgeon, has a plaque on her desk that says something like, "Don't confuse your 10-minute Google.com education with my 10 years of medicine."
That's a bit, that would be.
They come in, look it up, Google it. Okay, I'll go tell the doctor what I've got. So it's crazy.
Right.
That's what, and we have a lot of elderly family members, and I say, record what the doctor says. If you get home and can't remember because you're so afraid, or you're all tense and you're not listening, you're hearing what you're not paying attention. I said, record it on your phone or something, or bring somebody with you that can explain what the doctor just told you, because you know the visitation's what 10 minutes of that, and you know, and a lot of times you get home, how was your doctor? Well, I guess it was okay. So
I had a friend that had some serious medical problems, and he was admitted up at the Cleveland Clinic, and he was up there. So I'd go up and take his wife up so she could visit with him, and I took him up there. The docs had come around on rounds, and the fellow and the resident and the medical student and everything, the doctor would talk with him, explain everything to him, tell him what was going on, what the lab stuff was going on, and he said, "Now, do you understand that?" "Oh yeah, I got it," and everything like that. The doctors would leave, and he'd turn to me and say, "What did he say?"
Oh yeah, right.
"What did he say?"
I think that happens more often than you think. I really do. Because you're intimidated. You don't, you know, the doctor's the guy who's in charge, but.
I know when my oldest granddaughter was born, she developed, she had jaundice, and then she had to get hydrated, so they put in an umbilical catheter to hydrate her, and this was at Fairview Hospital, and then she got a staph infection. So she was she was pretty sick. So basically, she was septic. She had a severe infection, and I still remember the first night that she was in the neonatal intensive care unit up at Fairview. I was there and with my daughter and her husband, and the doctor comes in and is telling them this, and this, and you know, I'm thinking to myself, boy, this is serious, you know. But my daughter is just kind of okay, all right, you know, and just right over. They had no clue.
Right over there.
All she wanted to know is she was going to be okay or not. That's all she really wanted to know. So he's giving them all this clinical information, which just made no sense to them. It made sense to me, but not to them. And he was talking to them, and so I'm sure that we did it all the time. You know, we would tell people this and that, and they just They just wanted the bottom line. Am I going to be okay? Am I not going to be okay? Or so I don't know.
Well, we forget so many times
Yeah.
that we have learned basically to speak a different language.
Yeah.
than we do.
Right.
It's a foreign language to the patient. You know, you say all these big words that we've learned, and it's just part of our vocabulary,
Right.
and it just goes right over their head. They just don't understand. And it's not because they're dumb; they just haven't been exposed to
Yeah.
it. It's just, you know, I mean,
If I go get my car fixed, I just want to know
Is it going to run?
Is it
Or how
gonna
much
be
is it going to
okay?
cost? Yeah.
when can I pick it up?
yeah,
You know, so
that's right.
I don't know the mechanics of it. I don't want to know.
Yeah,
Just
yeah.
Yeah, it's very true comparison when you think about it, because you have no idea what they're doing, how
yeah,
it's being done. Is it being done, the right way
Yeah,
or the
right.
fastest way?
Yeah.
And then, of course, the bill comes. You got to figure out, was this the right thing to do?
Yeah, right.
And the analogy of the car and everything is so different because when I was first driving, I mean, I could fix anything on the car. It was so simple. I mean, I did valve jobs. I did all kinds of stuff. Shoot, now I looked up the hood and I said, I don't understand all
Yeah.
thing that's going on under there. It's all
Oh, yeah.
electronics. And,
Oh, yeah, it's right.
yeah. It's
Right.
just totally beyond me.
Yeah.
So it's a total different language. It's the same way with medicine.
Yeah, it is.
Medicine.
Well, we certainly appreciate you coming in, Doctor.
All right.
And